In this section, we're going to be taking a look at the concept of quality improvement. We will be taking a look at some of the quality initiatives and how they relate to the community setting. And we're also going to be taking a look at the student learning outcomes of providing safe, patient-centered, evidence-based nursing care for chronic and vulnerable populations guided by the Caritas philosophy. And we are going to relate how quality improvement measures enhance patient care and outcomes in the community. Quality initiatives are initiated at multiple different levels, federal, state, local, community levels, in order to maintain patient safety. So when we're taking a look at some of the national patient safety initiatives that are out there, again, they are concentrating on patient safety and quality of care. QSIN is one that we're going to be taking a look at. It's the Quality and Safety Education for Nurses. And this is taking a look at 6 different domains and competencies, looking at patient-centered care, quality improvement, evidence-based practice, teamwork and collaboration, safety, and informatics. And this is on starting on page 2696 in your textbook. You really want to take a look at the different competency levels and how that would pertain and how that would look for each of the different levels. On page 2700, it starts actually breaking them down into the knowledge, the skills, and the attitudes that are needed in order to provide safe and quality care to patients. And then looking at national patient safety goals, this again it was actually developed in 2002 to help accredited organizations deal with specific topics on patient safety. What I want you to do is, there is 2 sites that I want you to look at. They are in your syllabus. It's the Joint Commission. And last semester you were primarily focused on hospital national patient safety goals. There's also a table in your textbook on page 2701. It is table 51-2. And those are some sample national patient safety goals for hospitals. But I also want you to take a look at the ones that are specific to the community and home health care. They are a little bit different, and you do need to know the differences between what is expected in the community versus what is expected in the hospital. And then also, the last National Patient Safety Initiative is Healthy People 2020, which we have discussed, and that is really taking a look at the objectives and the initiatives at the national level in order to promote access to care and health for the nation. As far as community initiatives, take a look. The website's also listed in your textbook on 2702. But take a look at this website and see what is locally going on and what initiatives have taken place within the last couple of years. The quality improvement process, what does it look like? So quality improvement is a continuous process that is occurring in every facility, every institution across the country. And you need to understand that it is based on performance and industry standards. So one facility is going to be taking a look at how they are measuring against other facilities, identifying areas of weakness and what areas they can improve upon, and developing action plans based on this information. So everybody's quality improvement process is going to look similar, but what they are focusing on is going to be very different from facility to facility. So in taking a look at the analysis of the current processes and outcomes, you want to understand the different levels. So, and how a facility actually looks at identifying those quality improvement processes. So intradisciplinary assessment is based on a group of individuals that have a similar position. So this is a group of nurses that are sitting down to determine what are the outcomes, what is the area of improvement, excuse me, and then making a plan based on that information. interdisciplinary assessment is you have a group of different disciplines. So you might have nursing, you might have a social worker, you might have physician, case managers, a variety, people in the community that are participating in this process, a variety of individuals from different levels of care. And then again, they're sitting down, they're taking a look at data and figuring out where those quality improvement initiatives need to take place. Also, utilization review. A lot of facilities will have utilization review positions, and they are strictly looking at the resources that are used within the facilities and whether they're being used effectively, are they overused, underused, but it is based on the resources. Benchmarking is a method that's used to compare the performance of the facility against the industry standards. So again, when you're taking a look at nursing, what are the standards of care that are delivered from facility to facility that are the same? And then what you do is you say, okay, well, we want to be at 70% of what the industry standard says. And then you benchmark and you see, oh, okay, well, we're at 60% instead of that 70, so we need to develop that particular area. So we are able to meet the industry standard and get it up to that 70%. There's also a big push within the last several years that facilities reimbursement is being affected by these benchmarkings, by their quality of care that they're delivering. So there is a big push to improve the quality of the facility. So targeting areas for improvement, it's based on a couple different factors. Sentinel events are an automatic where they have to do what's called a root cause analysis, and that is problem solving to identify the root cause of the area of concern or the error that occurred. So sentinel events is anything that's an unexpected occurrence that involves death or serious injury, either physical or psychological, or a risk of injury to occur. The Joint Commission actually mandates that a facility does have a response to a sentinel event. So the goal is to have a positive impact on the patient's care. So if an event does occur through an error, it's identifying what is the cause of that and then developing a plan as to how are we going to move forward to make sure that this event does not ever repeat itself, or the chance of repeating is very, very minimal. So again, you want to have understand the factors that are involved in the event and then move forward and maintain confidence, especially in the public, because a lot of these events are publicized, so the public's perception of a facility is going to drastically reduce. And then your textbook lists different examples of sentinel events, but again, it's risk of injury or death, or an injury actually did occur. When you're looking at breach of care, this is when a nurse deviates from the standard of care. So either a nurse fails to do what is reasonably prudent for a nurse to do, or they do something that they should not have done. So examples would be that you gave incorrect medication to a patient, or maybe you failed to administer a medication, or you failed to complete a false risk assessment on admission to the facility and the patient fell. So not only do you have a breach of care, but if there was an injury that occurred from the fall, you'd actually have a sentinel event as well. And then risk management is a process by which vulnerabilities are identified and changes are made to minimize the consequences of adverse patient outcomes. So a lot of facilities actually have risk management teams that work within the facility to improve the quality outcomes. All of these factors are going to help promote better outcomes within the facility and for the patients themselves. So the root cause analysis I previously mentioned, but this is really taking a look at the process that is involved versus the individual performance. So an individual makes an error and it leads to a patient's death. They are not taking a look at the particular nurse that was responsible, but what was the process involved that led up to that error. So it's really, again, looking at that system and the process versus the individual. The ultimate goal is reducing errors, reducing medication errors. There's multiple different things that can contribute to medication errors, but as a nurse, you really want to protect yourself. Make sure you are always performing the rites of administration, at least 2, sometimes 3 times, depending on facility and what they mandate. But you really need to be very aware of medication errors. Stress level being disrupted during a medication administration, the stress level, new medications, not looking them up, they all lead to errors. So you really want to develop methods that are going to reduce the medication errors. Staffing practices, so looking at the quantity of staff that is available, and then also the quality of staff as well. RNs on the unit, it has been proven that the higher the number of RNs within a facility, actually the patient outcomes are better within that unit. So there's a proven link between that as well. So you're looking at quantity and you're looking at quality as well. And then resource utilization. So again, looking at the resources that are available, are they being utilized in the right manner to decrease not only costs but improve patient outcomes as well. One example would be the catheters that are used, Foley catheters within facilities. Some facilities have actually chosen to go to an antimicrobial tip that they use to decrease the risk of catheter-associated UTIs within their patient population. So what resources are available and how can we improve patient outcomes based on those resources? Also, a blame-free environment. So again, as long as you are performing based on what a reasonable and prudent nurse would do, then there's that blame-free environment. So you report the error that occurred, and the process and the system is looked at versus the individual that is responsible for that error. And then also reporting near misses as well, because if you do have a near miss, somebody else, if you do not report it, somebody else may make that same exact error, and it might have a detrimental effect on that patient outcome. So any near misses you need to report as well without that fear of retaliation or a punishment in any way. And then also personal responsibility. So you need to be accountable for your actions. If you do make an error, you need to say, I made an error. This is what happened, and you need to take responsibility for those actions.